using many times, and you can see in our logo also we call it as APISC, which stands for AIIMS Patna Incubation and Innovation Council. It's a unique kind of an enterprise given to a medical institute almost for the first time, because this started, I think if you look at this journey, which I feel is the real journey of our institute. Way back in 1819, there were a few MBBS students who came to us and they told that there is something called MedTech. And believe me, I didn't know what is MedTech. And as Dr. Sudeep told, that when you are doing medicine, you are so very focused because what your ambition is does not translate to what MedTech is when you are being trained. So as a medical professional, you actually start thinking that what will be, how do I see myself in next 10 years? How do I see myself in next, say 15 years? You have an ambition that, okay, I'll be a good clinician, I'll be a good surgeon, I'll be able to do this for me. And worldwide, if you believe, the medical technology has come from doctors. What has been fostered and what has been encouraged outside, not much in our country at that time. That's what I think was the difference. So when these students came to us, and we were a group of few faculties, I think I was there, Sudeep was there, Dr. Pritanjali, Dr. Monica, there were few of us, and they came with this idea that we should have a workshop and we should have a small club called Avishkar. And I was like, what is Avishkar? And they told that we will talk about something called MedTech innovation. We will have a workshop on that. And Dr. Prashant, he's one of our GB members now currently in King's College London, and he was part of IIT Patna Incubation Center, because they all start thinking that what is this, there's a profit and doctors will be getting it. You're supposed to serve, not supposed to earn. But then slowly the DST, Mr. Praveen Roy, Pramod ji, CS Yadav, they were instrumental in making us understand that what actually is Section 8. And then, with the help of our administration, totally with the help of our administration, we were able to open up this. Whenever I've gone with problems of incubation center, he has always helped us. So, when you are a Section 8 company, by a post, the executive director becomes the chairman. And currently, I am the PI with co-PI as Dr. Anil. And we have our whole GB, in which Dr. Prashant, as I told, he is now in King's College London. He was in AIIMS Delhi as a biomedical with the GB. We have a mentor group in which we have our Dean Research, Dr. Sanjay Pandesa, Dr. Pritanjali, Professor of Radiation. So that was the old building in which initially AIIMS Patna started. So AIIMS Patna lectures of MBBS 2012-13 were in these so-called rooms and labs. And now again in a better shape, but this was the area which was renovated and now looks something like that. It is on a constant improvement. So the lecture theatre now looks something like that. We have a full video conferencing facility available. We have incubation space available. We have office space available. So those who are trying to apply for incubation can get full Wi-Fi services. You can sit. You have all these meeting rooms available. And since it is a residential quarter, we could not make the wet lab there. So we took the help of Department of Physiology, Biochemistry and Microbiology to set up the wet lab. So we have all the equipments of the wet lab. The place is now ready to host all the incubatees. So that is what has happened as a change. And we expect that soon the first batch of incubatees are being awarded today. We'll be running established in, we have the inverted microscope, the ELISA, the PCR, the freezer. So there's a long vision which creates Mr. Dilip Jaiswalji. Once he just arrives, we will be starting.
Adopting in the Indian setting, the idea is to validate that tool in our Indian subset of population. Right? Then only it can.
Especially who are already employed. And what are the essential agreements should a healthcare startup establish to safeguard their interest?
Good morning, everybody. Thank you, ma'am. That as a matter of precaution, pre-intimation or permission from the employer should ideally be taken to avoid future disputes. And further, that if while being a founder is permissible, it must be done with complete transparency separation of roles, and strict legal compliance. It has been said that negative conveyor.
All our distinguished guests with floral greetings. Professor Dr.
The batch of first incubatees which we are awarding. We would not like to ignore the fact that it is because of people who are mentors and our administration which has helped us, and I would request Dr. Mosmi Saha to felicitate few people off the dais, in which I would like to name Dr. Pitanjali Madam, our mentor, APIIC, Dr. Pratap Patra, Dr. Asim Sarfaraz, Dr. Sudeep and Dr. Saraj have been felicitated before in the panel. So, Mosmi, if you could felicitate them. And Dr. Pratap, if he's here, Dr. Pratap Patra. He had just come. Advisor, Blockchain for Impact. We are fortunate to announce that AIIMS Patna has got another MedTech Incubation Center funded by BFI. We are hoping to start the whole work very soon. Naresh Nandanji, Member Secretary, Bihar Industry Association, and our GP member, who has constantly been our pillar of support in starting the whole setup of APIIC. Our Executive Director, Raju Agrawal sir, who has, again, I would say this whole thing was never possible if our directors were not supporting of this idea. And Agrawal sir has really supported us wholeheartedly.
हर स्टार्टअप के पीछे समाज की सेवा का उद्देश्य होता है और हर विचार में भविष्य को बदलने की शक्ति होती है। इसलिए ये केंद्र सहयोग, संवेदनशीलता और सृजनात्मक पे आधारित रहेगा, जिसे हम
taking this initiative and open this incubation center, because आप देखेंगे इंडिया में बायो इकोनॉमी काफी ग्रो कर रही है. It is reached to $195 billion. बट अपने बिहार का जो कंट्रीब्यूशन है वो अभी काफी.
प्रोफेसर पूनम भरानी जी, जिन रिसर्च डॉक्टर संजय पांडे जी, मेडिकल सुपरिटेंडेंट डॉक्टर अनूप जी, माय फ्रेंड अनिल जी, मंच संचालिका मैडम मौसमी जी, dear friends reading in the audience, and we feel very much scary about this. The first thing is charting an uncharted area. You are not aware of what of difficulty you shall have. Number two, the problems, the intricacy of that area. And third, the setbacks you can achieve in that area. All these things make many people not going for the traditional things we have adopted. I consider if you go for an instrument, it is Karl Stoss. If you go for robot, it is intuitive. Where are we? And those people are not those people who are having extra caliber. It is thus their determination, their validation of technology, and the constant effort, and the most important, industry ministers are sitting here, the political willpower, which will help us. So, friends, boundaries are there. We have to push the boundaries and to move ahead. It is not only our area, it's confined and cut side. For the place we are sitting and examining the patient. That is one part.
Government of Bihar for your guidance and insights.
आज एम्स पटना कैंपस में इंक्यूबेशन एंड इनोवेशन काउंसिल के द्वारा आयोजित उद्यमिता सम्मेलन 2026 डायस मंच पर उपस्थित प्रिंसिपल इन्वेस्टिगेटर APIIC डॉक्टर अनिल कुमार, को PI APIIC एंड डॉक्टर मौसमी साहब, अन्य सभी फैकल्टी मेंबर्स, स्टूडेंट्स एंड ऑल स्टार्टअप से जुड़े हुए लोगों, मुझे बहुत खुशी है कि एम्स पटना के द्वारा आज इस तरह के कार्यक्रम का आयोजन किया गया है। अभी तक IIT पटना और उस टेक्नोलॉजी को हम तभी अपग्रेड कर सकते हैं जब मेडिकल फैकल्टी, साइंस एंड टेक्नोलॉजी के फैकल्टी और ऐसे सभी डिफरेंट फैकल्टीज का म्यूचुअल कम्युनिकेशन हो, तभी हम किसी टेक्नोलॉजी मिल सकता है। और दैट इज रियल इंक्यूबेशन सेंटर। जब 2-3 इंस्टीट्यूशन, 4 इंस्टीट्यूशन मिलके कोई आपसी संवाद करते हैं तो वो रियल इंक्यूबेशन होता है। अभी जैसा कि डॉक्टर धीरज कुमार भी बता रहे थे, बहुत गर्व होता है लोगों को, बोलते हैं मैं भी इसी स्टेट से हूं, तो होता नहीं है। तो आपका बहुत जरूरत है। सभी चीज तभी डिपेंड करता है मेडिकल साइंस का जब तो बॉडी भी मतलब सरवाइव नहीं कर सकता है सही तरीके से। तो ENT अच्छा हुआ कि सिलेक्शन हुआ है इंक्यूबेशन में इनका मैडम का। तो मैडम भी मुझे लगता है कि काफी स्ट्रांग विल पावर के साथ। बिंदे साहब ने एक बात और आपने बताया कि अगली बार आएंगे। अभी हमने शायद IIT को 46 या 45 करोड़ का इंक्यूबेशन के लिए
grant under ITBI DST Nidhi scheme from APIIC. I would request life status management system. Innovation is kidney care, machine learning enabled mobile application for the patients. She has received a grant of 5 lakh. Award amount is 5 lakh rupees. His proposed innovation is modular spectacle mounted EEG system. Dr. Swarnim, Dr. Rehan, all are from the AIIMS Patna. Skill RX, AI powered clinical and surgical logging platform, and I would request his team member to be also be on the dais. They have received a grant of 4 lakh, and the mentor for Dr. Suraj is Dr. Kranti, Dr. Saraj, and request all of them to be on dais. Yeah. of AIIMS Patna. His proposed innovation is exonuria, and he had received a grant of 7 lakh. I would request his mentor Dr. Sudeep and Dr. Ravi Krishna sir.
Participant in this whole ecosystem.
Anand. Right? Dr. Murli Kumara Swami. Dr. Saroj is his mentor, Dr. Saroj K. Singh.
To propose a vote of thanks on behalf of the organizing committee for this wonderful and memorable events. First and foremost, let us express our gratitude to the Almighty God for guiding us and blessing today's program with great success.
Mission Director, Make in India for Biotech, for BIRAC, Department of Biotechnology, and Dr. Anand Bhan, Advisor Blockchain for BACT. He has been in the healthcare, public health domain for quite a long time. And we have Naresh Nandanji, Member Secretary of Bihar Industries Association, one of the earliest entrants into startup space. I would call them as pioneers in Bihar with respect to startup activities. And Madam Prandi Bhavna, the Professor in charge of Incubation Center at AIIMS and the head of ENT.
It is not only that PhD or this background are working in the field of biotech, but medical institutions are also very much participating in different type of product development. Like we have receiving several projects from the
medical professional, and then he approached IIT Patna for some engineering support, and then together
for biotechnology and for them only. And we are working from last 12 years, and we are working for each and every aspect of, and wherever the stage they startup are to be given by BIRAC. So then BIPP, now BIPP you are going to compete and you have now validated technology. But again you want to do commercialization. How you are going to commercialize this product, scaling. So then again we have a
long experience in public health and healthcare related aspects, and presently advising.
Almost 3 decades ago, I walked into a medical college when I got my admission. I came in from then the CBSE PMPD or the All India PMPD exam. And for the 6 years or so that I was in a medical college, there was zero exposure to an innovation thinking, right? Typically in a medical college, implants, etc., even vaccination syringes. One of the first things we did as when we were founded was support UNICEF and the government of India in terms of making vaccination syringes available. Because as you know, the COVID vaccination drive was among the largest drives in the world. And suddenly we had a shortage of vaccine, also driven by relatively newer technologies. I think idea is around, and sometimes it's not rocket science, right? It's sometimes just a simple idea, but with a strong promise which is supported through its journey. So some examples of that would be even in the area of trying to figure out what's a good way to do screening for cervical cancer. Now that's been a major challenge because you have, of course, pap smear, but pap smears are very difficult to do in primary care or secondary care, right? You have visual inspection with acetic acid, that's also useful, maybe can be done by the health workers, but you might sometimes have challenges with sensitivity and specificity. can you do something which involves imaging and back-end processing, so that a health worker can take an image and then can help identify who needs to be linked to confirmatory testing, right? And so some of those innovations I think are really strong. The other innovations by companies like Remedio, which have been working in this sector, are all about just using simple camera-based approaches to take images of your eye, and then at the back end being able to say that is this person someone who could be having a retinal issue, is this someone who could be having an issue with glaucoma. As our chronic disease burden increases, as you know, ophthalmic complications are among the most common ones, and usually they report quite late. So I think the ideas which are relevant to our
Dr. Kranti, Madam, you are a practitioner and you are an OT from morning till evening. I know that personally. So, how do you think people from medical fraternity, I'm specifically asking this question for medical students or practitioners who are sitting here?
I think that's a very relevant question, especially for us as medical practitioners. But the interesting aspect is that we have been involved with research work since long. As a medical, medical research is an important aspect of our career. What we feel in India as a challenge is the number of patients which we see, which is not, the number of doctors required to treat the number of patients in an institute is obviously not that high a number, and we are definitely enamored by number of patients which we have. So yes, the timing issue is something which becomes very personalized, and that is a challenge which I very best, because they definitely have free days in which they totally engage in research, where we perhaps lack as an institute. But then when you go to some other higher institute like AIIMS Delhi, PGI, there are consultants who will have certain free time. Very frankly, Joseph Ji was the one whom we contacted that IIT is doing something like incubation. But now when you slowly, I didn't even know the full form of TRLs. I know my subject. No, you also become very narrow gauged when you further specialize. So, me being a skull-based surgeon will never say that, okay, TRL kya hota hai? What is TRL1? What is TRL6? I don't know. So, people who are into this field, they know. So, it is here that you collaborate.
How is developing and how the policy is coming out from a government side. So, sir, in your view, sir, how is our policy supporting entrepreneurs presently, and what would you suggest to further the bio and life sciences innovation further, specifically, because the other general part of it's moving forward. So, sir, your take on those.
And especially with the government initiatives of promoting startup policies in Bihar, what we have seen that this is the right time for the startups to do their startups. And especially what Joseph ji asked about the medical fraternity, and we are sitting in the Center of Excellence for Indian Institute of Medical Sciences, Patna. The domain skill which you talked about, I have spoken about this blockchain, and previous guys spoke about this, what the Bharat is doing. I think if you look at the opportunities today, you have excellent opportunities in terms of your domain skills. And who will accept us? And there was a recognition problem that someone was asking interesting questions कि सर स्टार्टअप करेंगे तो लोग यही सोचेंगे कि इतने कहीं सक्सेसफुल नहीं हुआ इसलिए ये स्टार्टअप्स में आ गए. Ideas we are over supporting. Medtech centers of the APIC of the AIIMS is promoting, calling you. So these are the grand opportunities for you. You come up with your great ideas, you utilize those opportunities, and then your viable opportunities of domain skills become a great business solutions. And not you are promoting your ideas, you are solving problem to the society, you are problem solving to the nations. Like as I spoke with the data are going to be a very, very important aspect while in it.
Our BIA and similar associations, what kind of role do you play in supporting the startups?
Here it was agrarian economy, people were going for the jobs and all. Now in last 10 years, we used to somehow not only association, other incubation like IITs and all, say AMP, then promoting the startup ecosystems if you have that. And next, this 2047, if the government of India have initiative that developed nations, Developed nation will not become unless we have a 20 to 2050. Half of the million people will become employable, and half the million people will how become employable until you are not going to create a 1 lakh million successful startup.
That what is there in a recognition, but that in many young people's case, that recognition matters to their parents, because that
The fact that we need to think local but also be able to think and act global is extremely important. So BFI as a philanthropy is registered in the Netherlands, so one of the things we've been doing is look at the European market and also work with European institutions. So there is actually now an ongoing program which focuses on this kind of a cross fertilization of ideas and market opportunities. Innovation, especially with the focus on India. So you will find ways to reach out to startups. If you're a clinician, if you're a startup, you can connect to a clinician, to a faculty member, to a mentor, to funding opportunities.
And we all are, so for us as a medical professional is a new field, but a field with a lot of promises. And as far as AIIMS Patna is concerned, and we are collaborating with as many people as possible, especially with IIT Patna. And we hope that in coming days we will be able to put our footprints all around the country.
So creating opportunities that are one-stop solution. My suggestion is that you follow your passions.